It's important that, again, back to these healthcare teams, that physicians and nurse practitioners and physicians' assistants understand and appreciate the role that psychology has always played in terms of the research and the evidence base for how to help people change behavior. Back to the Affordable Care Act, we have mental health parity with that now. There are other ways also that psychologists can be engaged in the health system to help people change health-related behaviors. Mental health parity, though, will also be included in the Medicaid expansion and in the health insurance exchange program. So what this means is that individuals can have access with much less expense to them, maybe very little expense to them, to that needed kind of care. But it's also important to go back to the idea of the family, because people cannot change in a vacuum. You can be very, very motivated to change, but if you're not working with someone that understands the family dynamics, maybe the dynamics in your marriage or dynamics between you and your children or other things that are going on in the family environment and in your community environment that do or do not support the kinds of changes that you need, it's just really, really difficult.
I wanted to draw two other points of the survey. One is actually an interesting regional difference in stress levels. The survey shows that Easterners report slightly higher levels of stress than Americans in other regions. Why do we think that is, Dr. Johnson? I know it's a terrible time in Washington, but can it be that bad every place else?
Yeah, I think living in New York, Washington, there's a lot of high-stress jobs, and those cities attracts people that are very motivated and excited about moving their careers forward, but those careers can be quite stressful. That's one possibility. Mm-hmm. It's also expensive to live in those areas of the country. And as we know, the economy has really been in trouble lately. People have been very concerned with money. That was the number one stress, I believe, mm-hmm. In our survey. And so I think any area of the country where costs of living are high, you may see an increase in stress.
Could it possibly be, some people need stress in their lives or gravitate toward it, or is the Northeast a magnet for people who just love a stressful life or lifestyle or profession?
Well, actually, there's some indication in our survey data that suggests that there may be a little bit of that going on. For example, when we just look at the Washington, D.C. data, there was a higher percentage of people who said they were really energized by challenges. Mm-hmm. They really felt that they needed challenge or wanted challenge in their lives, so they gravitated to a place that had plenty of that available to them. The other thing that we found in the survey was the stress levels were lowest out west. And I think Dr. Johnson is right. You really have to say, well, there's something about the West that's great. Well, it could be, but it also attracts people who want to be involved in that kind of environment. So it's both the nature of the physical environment, being on the coast, for example, being in a sunny, warm climate, which does attract people who want to be with others who have a more relaxed lifestyle. It's a possibility.
And I would add, too, thinking about the East, and particularly it's highly urbanized, and it's maybe more difficult when people move into that kind of environment to really get plugged into support systems and networks. It may be more difficult to find whatever that group is that you're looking for. We're very mobile. Many people don't have family that live in the same area where they do in a lot of the highly urbanized areas. So I think it's probably a lot of those things. But another interesting finding in the survey that I'm not sure what the reason is a lot of the symptoms of stress that were reported, physical as well as the emotional symptoms, the irritability, anger, depression, anxiety, were higher in the Midwest than anywhere else. And you sort of think about the Midwest as the heartland of the country, and you dig in the dirt and get all of this good relief from your stress. But I was a little bit surprised by the very high levels, unless they maybe were partially affected by some of the city's data, with places like Detroit that have just been, just devastated economically But yeah, the Midwest people had highest reported levels on almost all of the emotional symptoms, as well as sleep disturbance and stomach problems and that sort of thing.
Another interesting difference in the survey was the difference between men and women, the gender difference. And the survey does appear to suggest that men maybe are just not getting some of the connections between their stress levels and personal health. They say they're more likely than women to say that they do enough to manage their stress. But if you look at their levels of stress-related illness, that doesn't necessarily compute, does it, Dr. Johnson?
Yeah, well, it turns out that women, in many studies, report higher levels of stress than men. So they could certainly be more stressed. They could also be more willing to acknowledge their stress. We found in the survey that women also report that they think stress is directly linked to health more often than men. They also report that they've tried to do something about their stress, often unsuccessfully. They also report that they think seeing a psychologist would help them. They do this all more than men. Men don't think they're that stressed. They don't think stress is linked to health that much. They don't really report trying to do too much about it. And in the survey, they actually had more chronic illness. They had more high blood pressure. They had more heart disease. And they had more diabetes. So I kind of agree with you. I feel like the men aren't really getting the link, and the women are.
So let's go to our token men on the panel and ask them for some perspective. Dr. Anderson, what do we do about this?
Well, I think it shows that we have to continue a fairly aggressive education campaign. I mean, 10, 20 years ago, even further back, it would be hard to get anyone, the general population, certainly not a majority, to say there's a link between stress and health. And it's certainly not in the medical establishment, but through research, through public education campaigns, through the work of community-based organizations like the Y, most people now acknowledge there's a link. But for certain subgroups, we still have a long way to go. Men, as you suggest, are less likely to admit that link, particularly for themselves. So I think we need to have some targeted education programs for men. And one example is the National Institute of Mental Health a few years ago started a program called Real Men, Real Depression, because there was depression is a problem for men. Men do get depressed, but men are less likely to seek treatment and less likely to acknowledge it. So I think through targeted public education campaigns, we can start to close that gender gap a little bit.
All right, well, we're going to go now to some questions from our audience near and far.
Near and far. Our first question is from Twitter. @JustBeachy asks, I don't understand the link between health issues and stress. What is that link?
Okay, well, we talked a bit about that, but let's make it a little bit more concrete, Dr. Anderson. We know, as we were saying earlier, that actually when you experience stress, and what is stress? I mean, cavemen saw a saber-toothed tiger, felt stressed. Chemicals flow in the body that activate responses. So we know now that those responses actually have health implications, as you said, on every organ system.
Yes, and the difference between what was happening to the cave people versus us today is that their stress peaked when they were running from an animal, but then when that was over, it went back down. Ours tends to be much more chronic, unrelenting, constant. The link between that kind of stress and health has to do with the effects on the body. So is you have stress here, you have illness here, and the thing in the middle is the biology. And by biology, I mean stress reduces the immune system's ability to protect us from illnesses. It increases activity within the cardiovascular system that increases the likelihood of high blood pressure and heart disease. It's actually been shown that people under high stress actually have arteries that are more clogged than others. And when people are sick, already and they experience stress, it makes the sickness worse. Research has shown that people with HIV/AIDS, for example, those under the highest level of stress have a more rapid progression of the illness than those who are in the low levels of stress. People who have heart disease, who have high levels of stress, are more likely to have a second heart attack than those who have lower stress. So there's a specific link between stress and physiology that leads to disease.
And could I just add to that? There's some very interesting research that even with a common cold, that people that are stressed, if you take a whole group of people and some people are stressed and some people aren't, and they do studies where they actually expose people to the common cold, the germs, and the people, not everyone gets, it turns out, when we get exposed to the common cold germs, most people actually don't get the common cold. Only some of us do. And it turns out when you do these studies that if you're stressed, you're far more likely to get even a common cold.
Mm-hmm. Again, the immune system response
it's the
probably
immune system effect.
playing into that. Great. Let's take a question here.
Good morning. My name is Leocadia Conlon. I'm with the American Academy of PAs. And Dr. Johnson, you said we know how to treat people with stress. Can you expand on that? And what I mean is, what methods or treatments are you referring to, and who is the we? Because I would say that as primary care providers, who are often in the front line, we don't have the expertise to treat stress. We don't have the adequate time in a patient visit. So can you give examples of what we should be doing and who should be doing it?
Sure. So for me, I think the ideal model is what we call an integrated care model, what Dr. Anderson was talking about, a team-based model, where a patient would come in to you and you would have access to somebody like me who you would call up and say, Dr. Johnson, I need you to see this person. They're reporting a lot of stress. But before you even did that, you would already have asked the person about their stress level. So we would develop this partnership, and then I would chat with this patient and we would come up with some ideas, some plans of how they're going to manage their stress. There are lots of ways to manage stress. Some of them have been suggested, certainly things like social connections, family, relaxation training, time management. There's a whole host of things we can use that are all evidence-based that show that you can help people manage their stress more successfully.
It's also possible to recommend that people go and access the services of the Y, right? We know that, as you were saying earlier, Jonathan, that whole notion of social support and peer support can be so important in your health. And we know that the contrast is true also. Social isolation is really bad for your health.
Yeah,
So,
and in fact, I brought this with me. This is something called the Big Picture Deck that we use at the YMCA. It's a visual tool for exploring well-being. Oh. And what we do is we invite people to come to the Y. We show them pictures, and we ask them what's going well in your life and what do you wish you could do better. And we have conversations about people's well-being, and we figure out how we can plug them in to social support systems at the Y. And there's not many places where you can go to talk about well-being. And we hope the Y and other community-based organizations will be such a place.
great.
Can I add something, too? I was going to say one of the things that we haven't talked about a whole lot here today that has a lot to do, I think, with our health is how we see the world as an individual, how we think about the world and about our situation. And that would be another strategy that psychologists could help people with. Because sometimes when you can't make the changes that you need to make, it's because you've got some thinking patterns that are blocking you and keeping you from being able to make those changes. And psychologists are pretty expert at helping people to analyze their thinking patterns and learn new ways of thinking and perceiving the world that are healthier maybe than the habits that they bring to the situation.
So if I'm a person